So I have a twin brother, and we were both 26-week preemie babies, and we spent the first 3 months of our lives in the NICU at Children's and Women's in Mobile. And I had a grade 3 brain bleed when I was born, and I have hydrocephalus and mild CP, cerebral palsy, on my right side. So we were in and out of hospitals growing up. I've had 8 brain surgeries, and obviously I've been around like pediatric nurses in the pediatric population, and they made a huge impact on me. And I was like, I could see myself doing something like this. And then my dad had Huntington's disease. It's like ALS, Alzheimer's, and Parkinson's all in one disease. And it was the end of October, and he had had a really hard fall. And he was in the emergency department, and I like hold his face and I just look at him because he had been going through sepsis and all of these comorbidities that we were like, we didn't know if this was gonna be it for him. And I looked him in the eyes and I said, I told you, like, I'm gonna be a nurse, and that's what I'm gonna do. I said, I'm gonna go and I'm gonna make sure that I can help people like you, patients that don't have a voice and that can't speak for themselves, and they're not getting advocated for. And I said, and that's what I wanna do. And he looked in my eyes and he said, okay. He said, I love you. He passed away in February of 2020, so I hadn't even graduated high school yet. And like, at that point it was like, okay, this is what I have to do. I have to go and I have to see this through. His Huntington's disease doctor was Dr. Sung at the Kirkland Clinic. And so him and my mom would make trips up here to go to the Kirkland Clinic. And she kind of mentioned, she's like, they have a really like good nursing program. My mom, obviously, she was a caregiver for my dad. She was a caregiver for her grandmother. She was a caregiver for her dad who had cancer. And she was a caregiver for me and my brother as kids. And I always tell her, like, she's a nurse in my eyes. Like, I think she would have been amazing at it. We came in March of 2020, literally the week before everything shut down. And we toured, and I was pretty much like, yeah, this is where I have to go. Like, I could see myself here. It was just kind of a feeling. Make it full circle, we had ambulatory clinic in 4th semester. And I ended up doing my ambulatory at the neurology clinic. And I got to watch Dr. Sung work with some of these neuro patients, and it was just kind of, everything just kind of leads back to my why. I'm ready. Obviously, being a new nurse is going to be scary and it's going to be a challenge, but I'm ready to take it on, and I'm ready to see what the field has to offer.